Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our special guest today is Dr. Peter Staats, recognized as one of the country's foremost interventional pain management doctors. We'll be back with our interview after this brief message from our sponsor.
Hey there, listeners. It's your host of the weekly podcast, Redefining Medicine. I have a question for you. How much time do you spend ordering functional lab tests for your patients? Ordering from multiple lab companies for hundreds of patients can quickly turn into hours of admin time. But there's a new way to order lab tests that I'm excited to share with you. Rupa Health is a tool that lets you order 20 plus specialty labs in a single portal. You can order all tests you normally do from companies like Dutch, Vibrant, Genova, and Great Plains, and so many more. Imagine you're ordering a hormone panel for a patient that includes tests from 3 different labs. You have to log into 3 different websites to place separate orders and then come back weeks later to check tracking number and download results. Rupa eliminates all of that by having all ordering, tracking, and results in a single place, and they also handle invoices, tracking shipments, automated follow-ups, personalized instructions for completing tests, and so much more. The best part about Rupa, it's free for all practitioners. Go to rupahealth.com, that's RUPA health.com, to join a live demo or sign up to see how it works. Now let's get back to today's show.
Today I'd like to welcome Dr. Peter Staats to the podcast. He is the current president of the World Institute of Pain and chief medical officer of the National Spine and Pain Centers. He is recognized as one of the country's foremost interventional pain management doctors, having been named among the top 1% of pain management physicians in the country by U.S. News and World Report. Welcome today. It's so nice to meet you and talk with you.
Thanks, Melissa. It's a pleasure to be here with you.
Thank you. So I see that you'll be speaking about harnessing the therapeutic power of the vagus nerve. Can you please explain what the vagus nerve does for the human body and share some tips with our audience from your lecture?
Sure. So we think about our nervous system conventionally with the nerves that control your ability to grip, walk, etc. But you really have 2 sets of nervous systems. You have the nervous system that is the motor and the sensory aspect, but you also have the autonomic nervous system. The vagus nerve is really one of the most powerful nerves in our bodies. It's the command and control center for all of the visceral structures. It's the command and control center for inflammation in the body, and it controls a lot of nervous system, central nervous system functions as well. And it is just this wonderful, underappreciated nerve. And I started working on this 15, 20 years ago and figuring out how to tap into that nerve and improve vital functions in the body.
Okay, so what are your thoughts on how to implement mind-body medicine? As we see, many articles are now indicating that we need to treat the body as a whole versus just different compartments.
Yeah, I think my whole life I've been looking at integration, and historically we have isolated out the various organ systems, the lungs and the heart and the brain, and we send people to various specialists. And we've not thought about the body as a whole. And I think that's a big miss for us in our modern medicine today. And how do we integrate everything and pull it all back together? When I got started, I think, one of the first things I did was I wrote a paper called Psychological Behaviorism Theory of Pain. And it was a method for unifying cognition, behavior, and biology. And it really integrated the various aspects of things, because I don't think you can separate them out. I don't think it's the mind or the body. The body and the mind are truly one, and things that you do in your body will affect your mind and vice versa. And it is an ongoing back and forth that we really need to think of things together as a cohesive whole.
Yeah, and it seems hard to keep them all balanced at the same time.
Yeah.
But I guess.
Well, that's part of the value of what I've been studying is in the vagus nerve is in our world today, we are driven and our sympathetic nervous system is in constant overdrive. I think historically or teleologically, when we were, caveman era, you would, see a bear and you'd run away once in a great while, but most of the time you'd be calm and relaxed. In today's world, we are constantly in anxiety and sympathetic overdrive, and we need more parasympathetics in our system. And I think that is part of the goal of medicine today, is to improve our health, and wellness
wealth,
overall.
Right? Yeah. So what are parasympathetics, just to clarify?
So the parasympathetic is the nervous system that keeps you calm. And that's the way to think about this. And the main nerve of the parasympathetic nervous system is called the vagus nerve. And the vagus nerve is the control of the lungs and the heart and the stomach and the colon. And it provides information to the brain about what's going on throughout your visceral organs.
Okay, thank you. Could you please tell us more about the National Spine and Pain Centers?
Sure. So National Spine and Pain Centers is the largest integrated network of pain physicians in the United States. I think today we have offices in about 13 states and about 1.2 million office visits a year. We have over 300 providers in our group, and our goal is to relieve needless pain and suffering. And we do that through an integrated pathway. We train our physicians. Our physicians come to us very well trained. And then we create guidelines. They're not real guidelines, but just general strategies for managing the pain, managing patients' problems with pain.
What are some exciting breakthroughs in pain management?
Well, I've been involved in academic medicine around pain for the last, I'm afraid to say, 30 years. And it's really an exciting time. There are 3 areas that I think are transformative for most pain physicians today. The first is the field of neuromodulation, the use of electricity to modify disease, not just pain, but disease. The most effective therapies we have for a lot of chronic pain problems today involve implantation of electrodes on the spine to control pain. We're now actually taking the invasive part of that major surgical procedure out of the hands of the surgeon and really giving it to the patient to use non-invasive approaches. So neuromodulation is really one huge area of advancement for medicine. The second, I would say, is the advent of ultrasound guidance, because that is allowing things like regenerative medicine to be very targeted in how we're approaching our problems and dramatically improve diagnosis. And diagnosis is critical if you're going to care for a patient. You can't just say, Mr. Smith hurts, and let's throw opioids at him. You really need to know what the problem is so you can come up with the most rational therapeutic plan. And then the last is a huge overlap with this A4M group is regenerative medicine. I think we're just on the cusp of really figuring out how to harness the control and harness our ability to use regenerative medicine in a very sophisticated way that will advance medicine generally. Mm-hmm. We integrate chiropractic care in our healthcare system. We integrate psychological care into our healthcare system. And we're going to be integrating integrative medicine into our system to give the best care to an individual patient. And it's got to be individualized for that patient.
Mm-hmm. Of course. So you continually do testing with each of your patients and create specific plans for them.
So, of course, we want to invest in an individual patient, but we also need to invest in large-scale clinical trials, trying to figure out what works on a global scale for a patient with this set of symptoms is going to be really important. Only by doing that type of work will we be able to compare it to traditional allopathic medicines and pharmaceuticals, et cetera, and figure out what works better. And at the end of the day, there are individual strategies that should be integrated for all patients. Mm-hmm. And we're going to come up with that kind of treatment algorithm based on a differential diagnosis of a problem.
Okay, very interesting. I'm sure our listeners will love all the tips and knowledge you've shared. And congratulations on 30 years. You've really achieved so much within that time.
Well, thank you very much. I appreciate it.
Thank you.